casting simultaneously on healthcare on an ongoing basis. When you listen to the podcast or if you have any questions, you can chat with me on the stream on the stream. So you can make some comments, make recommendations in changing the topics, what we need to address. Today, the topic is individual certificate of guaranteed coverage. Yes, individual certificate of guaranteed coverage. Empowering the individuals. Yes, that's the goal, empowering the individuals. So, individual certificate of guaranteed coverage empowers and guarantees everyone, individual health insurance, even if they have a pre-existing conditions or need of a financial assistance. Segmenting the uninsurable individuals to the premium subsidized impaired health support plans can lower premiums for others by 15 to 20%, folks. 15 to 20%. Let's elaborate further. Maybe you identify yourself as someone you know is wanting individual insurance. In that case, for the individual health can challenge at no cost that underwriting decision with the health review authority, which is set up by the public private partnership. Yes, it's a public private partnership. It doesn't cost anything to the government, and it is least economical way, so it doesn't affect the states with too much burden on regulations and all that. So health review board is a public private partnership set up by the public private partnership. Here is how it works. There are three potential actions on health review authority can take. Yes, health review authority can take three actions. Once it's rejected by the insurance company, the health review authority takes the applicant. Very first applicant determined upon review by the health review authority to be insurable, it will be given a certificate of guaranteed coverage to secure affordable coverage at rates appropriate to his or her the health status and history. So once you get the certificate of guarantee, folks, you don't need to go through the underwriters on a yearly basis. You are guaranteed for health coverage and renewable every year without any issue. So the premiums are based on the risks. Again, right now the insurance companies are basing the premium on general risk pool from all aspects of the coverage, but consumers doctors feel that risks need to be segmented into four categories. One is a well category, the second one is at risk category, individual person, and even to choose the health insurance. They have to be very transparent. Insurance premiums have to be transparent, folks. You should be transparent based on the categories, four categories, which I mentioned earlier. Again, well category They can advertise like what we are seeing on a daily basis. They can advertise well category premiums are this, at risk category premiums are this, chronic illness category premiums are this, and catastrophic category premium. So they need to be based on the segmentation, folks. We cannot go on like the way, like right now under the Obamacare, state mandated, the premiums are rising because they're being subsidized by the government and the private insurance carrier. Basically, the government is competing with private insurance carriers. That that puts the burden on private insurance carriers, and they raise the premiums. So we need to set up this. I would like to see a public-private partnership succeed because that's probably the best option for all Americans. So coming back to this individual certificate of guaranteed coverage. You can take to any participating carrier, not just the original rejecting insurer. You can go to any participating carrier with full transparency in premiums and guaranteed issue of coverage for pre-existing conditions. Premiums will be at a standard rate with any premium rating not to exceed 10% over the standard premiums. So once they they are transparent on the premiums should not be anything more than 10% over the standard premiums which they're advertising, or temporary benefit limits as deemed appropriate by the Health Review Authority. So the participating insurers must accept certificate of guaranteed coverage equal to the number of individual applicants they previously for coverage, rejected for the coverage. So insurance carriers rejecting relatively good risks might find they are required to accept much worse risks. By balancing the application process in this way, insurance carriers will begin to accept more applicants and the industry underwriting standards will automatically voluntarily moderated in favor of consumer. Yes, in favor of the consumers. So that is the first category. What is the second? Individual determined to be insurable. Individual determined to be when an applicant or a family applies, if it's determined to be insurable but in need of a financial assistance, individual or a family need of a financial assistance as determined by the state and or federal law to pay the premium they will be given access to premium subsidized state or federal health insurance exchange. So what these folks will, instead of getting this Medicaid, this is where it has, this is a private health insurance guaranteed by the certificate of guaranteed coverage. So these people, second category, people in need of financial assistance, and they're insurable, but they need help. So instead of giving this or Medicaid, they would go to the Health Review Board. Health Review Board looks at the applications. They basically need some financial assistance. They issue a certificate of guaranteed coverage basing on state or federal health insurance exchange set up by the state or federal agencies. That's where the individual or family can get a coverage like any other private insurance. This is what this is, and they get to they get to choose their doctor. They get to choose their facility. They get to so they have it is you're not categorizing into bronze, silver, and gold. That is a tier system, folks. Again, I don't know. Somehow I feel like we need to have the equal access to all Americans, irrespective of their economic status, folks. This is what I, this is what we have been saying all along. We need to have access. Everyone should have an access and freedom to choose their doctor, their hospital, and medications. So this is the second category. When they need of a financial assistance, you should be able to get the insurance carrier they have to accept this certificate of guaranteed, which is guaranteed by the state or federal insurance exchanges. So what is the third? Morning coffee, folks. Morning coffee with consumers doctor. So what is the third category? Eligible individuals determined to be uninsurable are given access to an health support plans. Impaired health support plans. So they have this third category. Health Review Authority will determine if they are not insurable, and they can go into these impaired health support plans offered by the insurance companies. Once this impaired support plan is selected, in the insurance companies will know, first of all, even the rates are different, but insurance companies are not obligated to offer the coverage to that applicant, but the state and federal agencies will step in and provide the plans through an insurance exchange program. As you can see, with the certificate of guaranteed coverage, anyone wanting individual insurance is guaranteed a plan, even if they have a pre-existing conditions or in need of a financial assistance. That's the beauty, folks. What it is, once you get the certificate of guaranteed coverage, there are insurance exchange plans. If they're not uninsurable, they will take, insurance companies are not obligated, but they can come with insurance exchange plans for uninsurable group, which is subsidized by the state and the federal government. That's also, they should be able to choose their doctor, they should be able to choose their facility, they should be able to go to any hub and receive the care. And this is where we need to focus on. Our focus should be on the uninsurable group because of the illnesses they have. Our focus should be on these groups, and that way we can provide coverage to all the Americans. And these 28 million Americans, I'm pretty sure what we have, there are not insured right now. Majority of them and will fit into the first plan, which was they should be able to get certificate of guaranteed coverage, and the insurance companies are obligated to take them, and they are guaranteed by the state and federal. Even the second one with the pre-existing illnesses. There are some folks with pre-existing illnesses from that 28 million. Our main focus should be on the third one, people with chronic illnesses, people people with at-risk category. These are the folks our focus should be on. This is where we need to have elaborate care and through telehealth, telemedicine, and also they need to be seen in the hubs, and they can be compensated basing on the level, and they have to be educational classes for these categories. They have to be certain things we need to. They're mandated to go through certain training, and they need to be seen in the clinics and need to be taken care of. So people with chronic illnesses like diabetes and hypertension, most of these patients can be managed on telehealth. 20% of the folks need to be seen physically, but majority of these folks can be not only be monitored by a nurse practitioner, even the nurse in the office can monitor them and give the instructions to the nurse practitioner or a family practitioner to be proactive and try to help them what it is. So we are focusing on people with chronic illnesses. This is when I mentioned about these four categories, majority of the folks in the well category, you're talking about 62% of the population folks, they belong to the well category. Their premiums have to be lower and have to be affordable, need to be transparent, and they need to be, these insurance companies have to be advertising for the well category at that particular premium, and their premium cannot vary more than 10% in that category. And they have to justify if they're giving premiums higher, they have to give a reason why they're charging extra on that premium. But once they advertise, they have to be transparent. And people with the people with at risk, at risk, like as we talked about, smokers and obesity, hypertension, they also need some extensive. They need to be seen and followed and educated. They need, even the premiums have to be based, even for the at-risk group. If you take some, it's like a driver's license, folks. If you go for a driver's, if you get a ticket, what do? You go to a class and get your premiums lower. Otherwise, your insurance will go up. It's exactly the same. And people with chronic, this is where our maximum claims are from the chronic illness category. There are 16% of the folks filing 41% of the claims. This is where our most, the premiums have to be transparent in this category. So they need to, again, they cannot vary more than 10% of whatever the premiums advertised. So they can focus on that. And that way, you are focusing on people with chronic, 16% of the population have chronic illnesses. We can maintain the focus on the laser focus on these categories. This is where we can not only lower the premium in this category, we can lower the cost. And finally, it boils down to this uncompensated care provided by the hospitals. Basically, what the government has done, they have given, they took away the, instead of government taking care of the burden, they have given it to the hospital. That's wrong. But hospitals should not be burdened with uncompensated care. There's a legislation passed by EMTALA, which is a EMTALA is a legislation where people when they're seen in the emergency rooms, if they don't have insurance, they have to provide the care. And that's where the hospitals, they lose, and the emergency rooms are overcrowded with uncompensated patients because they have no insurance. This is where the governments have to step in, try to take care of them and give them the opportunity to provide them certificate of guaranteed coverage. So that way you're not putting the hospitals under stress. Our focus should be to give the certificate of guarantee, so that way even providers, they don't take, a lot of providers don't take care of Medicaid. Some of the providers don't even take Medicare because the payments are going lower and lower and lower, and it is causing, and a lot of physicians and even providers, with too many burdensome regulations, they're giving up on their private practices. They're joining the groups, they're retiring. And this is what puts the burden. If there are less providers, and it affects the quality of care. And that's why we are training more nurse practitioners to take over the burden of few physicians in the pool. So there are a lot of ways to address. This is the way certificate of guaranteed coverage provides you a personalized healthcare. So if they are saving their premiums, they can put money aside into the HSAs. Their incentive, you have to give incentive. You have to provide the tools. They can put the whatever, even if it's $100 to $50, you can put every month into the health HSA accounts. I understand people with uh, in the lower, they don't, in the lower socioeconomic. I'm talking about average folks. Everybody should have HSA accounts. That way, you're keeping the funds for a rainy day. Folks, thank you for joining. I'll continue to address these topics on a regular basis. Listeners out there, if you're if you have an opinion, you have any concerns, do make some comments and subscribe subscribe and hit that bell and also share. I want to educate. This is consumers doctor, works for the a volunteer for the foremost organization. My goal is to educate people. That's all my goal is, to educate and give the information and provide the necessary tools for everyone. Again, thank you for joining Consumers Doctors channel. I'll continue to, on a daily basis, podcast, stream, and live videos on YouTube. So we will see you in another episode. I love you guys. Do make some comments, and I want to be your consumer's doctor. Yours consumer's doctor. You can express even individual illnesses if you guys have anything, you have a impaired ability, do let me know so I can address and how to get this thing going. We will see you tomorrow at the same time. Thanks again. This is Consumers Doctor, volunteer for the Foremost organization.